The American Cancer Society has designated September as Prostate Cancer Awareness Month. Other than skin cancer, prostate cancer is the most common cancer among American men. The American Cancer Society estimates this year in the United States, over 238,000 new cases of prostate cancer will be diagnosed, and almost 30,000 men will die from the disease. Prostate cancer is the second leading cause of cancer death in American men, behind only lung cancer. The specialist at Florida Hospital Waterman's Cancer Institute explained that while about 1 in 6 men will be diagnosed with prostate cancer during their lifetimes, it is a highly curable disease.
Well, the most common cancer that we see that men get is prostate cancer. And prostate cancer affects close to 300,000 men in this country every year. The key to being successful in treating prostate cancer is catching it early.
Prostate cancer is by far the most common cancer in men. The thought is that if all men live long enough, everyone will get it. Before the advent of the PSA blood test for prostate cancer was often detected quite advanced. Patients would come into the ER with their urine obstructed and prostate cancer all over their bodies. The PSA blood test is a very simple way of measuring for the probability of prostate cancer in a person. So while PSA screening at one point was recommended for everyone, now it's recommended more so on a case-by-case basis and done with informed consent with the patient's primary care physician, so that if you do engage with it, you understand the potential benefits and the potential risks.
There's several options that patients can have for treating prostate cancer. You can treat those with surgery, and usually those are well-selected patients who have good health, usually often less than the age of 70. Those patients could also be treated with radiation therapy, and radiation therapy can be done in a couple of ways. One is to use radioactive seed implants, which can be permanent, and those radioactive seeds are placed into the prostate gland to deliver a high dose right to the prostate. That is an outpatient procedure. It's done once, and it's very effective for what we call lower stage intermediate risk and low risk cancers. For patients who have a little bigger cancers or are a little more aggressive under the microscope, we recommend they be treated with external beam. And the external beam technique that we use is image-guided, intensity-modulated radiation therapy. And that allows you to deliver a very high dose to the prostate gland utilizing sculpted radiation therapy, so you can deliver treatments very precisely to the prostate gland and minimize dose to tissues around it, like the rectum and the bladder. And by doing that, you're eliminating the cancer and preserving the normal tissue around it. So you don't have the adverse effects of surgery. You typically don't have as much problems with impotency. The risk of incontinence is practically zero, and so there's a therapeutic benefit. You do have to trade off some time. Typically, external beam radiation therapy takes about 8 weeks of therapy given on a daily basis.
If you'd like to join the many prostate awareness fundraising and screening events, we've included the link with contact information to all the services offered at Florida Hospital Waterman's Cancer Institute. You'll find them when you click the Prostate Cancer Awareness Story Link icon on our homepage, yourhometownhealth.com.